Veneers vs crowns, what they are and what the differences are. So veneers and crowns are two different things. A crown is usually used after something like root canal treatment or where you've got a very large restoration in the tooth. Essentially with a crown, you need to file down all the sides of the tooth. So it's a 360-degree preparation of the tooth, and essentially you just have a stump left off the tooth. The crown then goes over the top of the tooth. It is very durable. It sticks to the tooth very, very well and is quite strong as well. So usually you tend to have crowns on back teeth where there's large fillings after something like root canal treatment where the tooth is quite brittle. It can be quite expensive, certainly in the hundreds of pounds, and there's different options for crowns. You can have metal crowns which need less preparation, that are kinder to the tooth, but obviously they look metallic. They can be silver or golden color, or you can have porcelain crowns which need a greater preparation to the tooth, almost twice as much, but obviously are more aesthetically pleasing. In terms of white crowns, they can have like different materials, things like emax, which are a more cosmetic sort of looking crown, or something like zirconia, which is still a white crown, as emax is a white crown as well on back teeth, but zirconia is a little bit stronger, but not as aesthetic. But sometimes that's quite acceptable to patients because it's at the back, so kind of you can't see it as much as long as it's white, and it's a lot better in terms of strength wise. But certainly the best thing for a back tooth is a thin metal crown or a gold crown because it needs the least preparation. However, these days lots of people tend not to go for them because they don't like the look of them. Veneers tend to go on the front teeth, mostly in the smile line there, and it tends to be that you just shave down the top of the tooth and the front surface of the tooth there. Sometimes you can even get non-preparation veneers depending on if you've got quite small teeth anyway, and they can go over the top of the teeth and they can help to close gaps or make the teeth look slightly bigger than what they are. It certainly depends on why you're having a veneer on the tooth. Sometimes you need a veneer because the tooth is discolored, or perhaps you've got large fillings on the tooth already, it's had past decay or trauma. In terms of veneers, again, they range in the hundreds of pounds, so it's quite an expensive treatment. Veneers can be made out of different things as well. You can get composite veneers that tend to need less preparation, but then again, they're not as strong as porcelain veneers. Porcelain veneers tend to last for longer, about 10 years or so, whereas composite veneers would be more like 5 years or so. And with porcelain veneers, they tend not to stain, they tend to be stronger, but certainly you don't use veneers on back teeth because they're not as strong as full-on crowns. However, people would tend not to want to prepare their front teeth to the level that you would need preparation for a crown, because the crown would literally leave a stump shape on your front teeth, whereas a veneer is a lot kinder preparation on your front teeth as well. And again, with porcelain veneers, where they don't stain, they certainly last for longer. However, you must have in mind that everything has a lifespan, so even with veneers lasting 10 years or so, it may well be that gums recede around the veneers. You start to see like a line from where your gum has receded, where you start to see your own tooth exposed, so they may need to be renewed after a certain period of time.